offices and all that. So rather than concentrate on providing resources for the training of these medical students, they divert it. They are enjoying the booty. Yeah, so it is, and that was why I said it is all about a grab syndrome of resources and privileges in the healthcare sector. Okay. And you know, for so long, we have worked this madness. I'm sorry, you will permit the use of words. We have allowed them this unfortunate status quo for too long, for far too long. But now, as responsible citizens and representatives of our people, we are going to put a final stop to the many excesses of Nigerian doctors.
Okay, let's take you up on a couple of things. Let's start with acknowledging the fact that it is likely that the large number of people that work within most establishments in Nigeria, where they're not really fully functional, but yet they get paid for being assistant to an assistant to an assistant. All of these things happen. It's across the board in Nigeria. Our government is bloated. Our health sector is bloated. But it is known as well that all around the world, consultants are people who are of great value. You would admit that, won't you? Mm-hmm. And those medical consultants are people with a level of expertise and experience that will add value to the health sector. So you cannot discount the fact that we have quite a few medical consultants in Nigeria, would you?
Let me say this. A lot of the time, you know, the NMA propagandist machine is always alive and well.
But this let
me just make the point.
I'm talking from traveling around the world, and
fine.
I know
it's good that you've traveled. Let me say
you
this.
Find a consultant.
You travel.
You know the quality.
I'm happy that you said you gave information that you've traveled around the world. In other climes that you have visited, do you have a bloated figure? The type of bloated figure. What I belong to the. I don't want to mention names now because I need to protect certain interests too. I belong to one of the boards I talked about, and I know what goes on. In the city of Lagos alone, we have over 2,000 honorary consultants in various colleges in medicine through the two major teaching hospitals, one for LASU, the state government, and there is one federal. There is a specialist hospital, orthopedic hospital, there is psychiatric hospital, there is Federal Medical Center. There are 5 institutions. You have 2,000 consultants. Look, let's be realistic here. What are you doing with 2,000 consultants? In those other claims that you talked about, yes, what happens is that you will have a consultant orthopedic surgery or consultant orthopedic surgeon who consults in that same enclave for those 5 health institutions. So if he's supposed to be in Lutz today, he probably puts in 4 hours. On Mondays, the same consultant is in Lasut. On a Wednesday, he puts in some hours, and he's very well paid. That is the way they run this. That is why it is consultancy services. I agree that it is also about training, and that's why you have these people in hospitals. Some bold CMDs will tell you, and I'm saying from viewpoint of vantage, privileged information, that this thing is just about sharing booties. Because you do not need,
2,000 consultants.
You do not need 2,000 honorary consultants and hospital-based consultants to render services in one city.
In one city.
Why honorary?
Population? The population.
It is honorary. Once you are a university lecturer, that's the designation they come up with. So the man is a lecturer in the university.
Okay, but he's consulting for the hospital, for the teaching hospital. Okay.
Because it's the teaching hospital, he must teach students. But I'm saying that you do not have to bring all of those people, because these are the real reasons why the health sector is in a state of perpetual coma. Because all the resources that should have been channeled to replace obsolete equipment go to all the hospitals. Okay, the last time we had comprehensive infrastructure was the golden era.
Okay, Mr.
When health administrators were in charge of these health institutions.
Mr. Akintayo,
yes.
Let me just ask this question, and I'll ask the same question all around. Do you think we have enough fund in the medical sector today? Because it's one thing to say that most of the money go to consultants and those who are grabbing.
Salaries.
But at the end of the day, do you think there is enough money budgeted for our health sector in Nigeria today?
You want me to
It's
answer
a quick
that?
question, a quick answer to that. I don't want an analysis.
It might not be enough. But the critical question here is, please ask questions. What has been done with even the little that has been provided? Look, we carried out a study, and I am speaking from evidence-based data. We have a research department. It conducted a research. In Nigeria today, we say, yes, WHO recommends about 13% minimum health budget. Nigeria is a signatory to that. So this year, I think the health sector was allocated 6 or 7%. But we carried out that survey, and we discovered that a whooping 92% of the total budget in healthcare is actually dedicated to the payment of emoluments.
Jesus.
Out of this, and that's why I'm presenting these things, out of this in apocalyptic terms, in absolute terms, 59.88% of this total budget is dedicated to the payment of only one cadre of personnel, medical doctors, at least at federal level. Now, is that the trend that you want to continue? That is why a lot of it, in the part of the world that I come from, they say even if you give a madman a hole to come up with hips, naturally he hips towards his side. That's why I portrayed that situational analysis, so that you see what goes on. So what goes on is that people are definitely out there to maintain only a narrow and selfish interest. You know these doctors who are protesting, let me give this information. I say it before my creator. Immediately after youth service, at the level of government, a medical doctor is placed on grade level 12. These doctors who are giving you, members of the public, the president, they are oppressed, grade level 12, post-youth service. Do ask. I believe you're also university graduates. Any other university graduate who starts on grade level 8 after youth service, it will take a minimum of 10 years for you to get to grade level 12, which is where doctors take off from youth service. And yet they give consumers of health and people the impression that they are being marginalized. Marginalized by who?
Okay. Let's bring in Ugo at this point. Ugo, after listening to all this analysis, do you have any suggestions as to how this might be resolved?
Listening to all of this discussion is making me angrier. I'll tell you the truth. Because the only thing I have watched parts of the press briefing, and I've listened to him. I'm not seeing anything apart from politics. That's what I see. Purely.
Politics, and people are dying by the minute.
And I'm talking about politics that completely excludes the so-called health consumers. Completely. In all the demands that we're talking about, I'm not seeing anything that looks like what will make, the man on the street happier when he walks into a hospital. He gets better health care. He pays less. He has available health care.
That's part of it somewhere. It's there.
No. What I'm saying is that, and it's also clear to me now that it is not a fight between the NMA and government. It is a fight between NMA and the other health professionals. So it's a bit complex. It's not as if because they are asking for this, and these other people are saying, why do you ask for that? It does not protect our interest. You have marginalized us for a very long time. And in all of this, like I said, the medical doctors can put up their position, the pharmacists can put up their position, the allied professionals have put up their position, but I'm seeing nothing that has to do with, because if you say you have 1 million consultants, for instance, and they are all doctors and they are all paid, does that translate to better health care for instance? I don't know if he does. If he does, all well and good. If he does not,